Hi, my name is Aaron. I'm going to be doing a presentation about the rupture of the AC in the shoulder. A rupture is a complete tear of muscle or ligament. The AC stands for acromyoclavicular joint, and this injury involves the clavicle, which is your collarbone, separating from your scapula, which is your shoulder blade. Causes and symptoms. These are mostly caused by direct impact to the joint from a fall. Basically, these are common in sports such as football, rugby, and even cyclists, because when you're in a contact sport, if you get into a situation where you hit something with force, the pressure from the impact can rip the ligaments in your shoulder, and this is in cyclists as well, because when they drop off their bicycle or their motorbike, then it can happen as well. Symptoms: you normally feel a lot of pain in the region, you'll see a lot of swelling, and you probably won't be able to move it as well, depending on the severity. So if you got mild swelling, then it could be like a grade 1, which is not a full rupture, but just a sprain in the ligaments. So you'll just feel a bit of pain, and you'll probably have a bit of immobility for about a few weeks. And there might be a deformity in the joint depending on the extent of the injury. So if you got a full-blown rupture, then you might see your shoulder just hanging off a little bit or something. The first stage for treatment is put ice directly on the point after injury. With shoulder injuries, rice isn't really a good way of treating it, because if you elevate it, it could cause greater damage to your shoulder. So it's best to immobilize the joint using a sling or something like that. A rupture is a very severe injury, and it usually requires surgery. So after the incident has happened, it's best to get medical help straight away, and the doctors will usually assess the injury and assess how badly it looks and how badly the ligament is torn from the different points, and they'll probably send you to a surgeon. Before they send you to the surgeon, they usually use tape, and they put tape on the joint. So they'll put tape across the sides here to keep it more stable, because when your clavicle and your scapula is separated from each other, there's nothing really holding it together. So you have to make sure that it stays in place to avoid causing further injury. They also give you some medication as well if you do feel a lot of pain. Rehab. After the immobilization period, which will be about 6 weeks, depending on if you have surgery or not, then you normally start with small non-resistant exercises, and one exercise that they use a lot is called the pendulum exercise, and that's basically because your joint, after surgery, it will be connected again. So to get the range of movement back to how it was before, you normally just bend over like this, and then you move your arm in a small circular motion, and then you gradually get bigger to get the range of movement a bit wider. And then after this, in rehab, this is normally within the first 2 weeks, because it doesn't put pressure on the joint. And you can also do isometric exercises, which involve, say for example, I'm by the wall here, yeah, and then because I've got my injured shoulder here, I can just push my arm against the wall, rotate my shoulder, and then that will help to strengthen your shoulder and get the range of movement back again. And after about 4 to 6 weeks, depending on the severity, it's very individual. You normally do start with resistant exercises to start strengthening the muscles and the muscles in the shoulder and around the shoulder, So when you start resistance, normally they tell you to start on the muscles around the shoulder, because they become tight after injury, because they basically stop your injury from getting worse by becoming tighter. So you have to do things like work on your chest and like your deltoids and stuff like that before you start the proper resistance on your shoulder. And after, when you're pain free, basically you can start doing the same movements like rotation exercises, but with armbands and weights and stuff, just to get the strength back in your shoulder. And that's it.
Thank you.